مساء الخير. أنا طبعاً سعيدة جداً بوجودي بالكونفرنس الرائع هذا. أنا من كردستان العراق من محافظة أربيل، مسؤولة الكواليتي أشورنس في هيئة البورد الكردستاني العراقية. اليوم أنا راح أقدم مختصر عن الريسيرش اللي عملته في كردستان حول الإمباكت of polycystic ovarian syndrome on embryo quality and assisted reproductive technology outcomes. It is published in the AMG journal at Board Kurdistan. So, the background of this research, all of us, we know the polycystic ovarian syndrome, one of the most common endocrine disorder in women reproductive technology. My colleague, they speak a lot about pathophysiology and the problem of PCOS. It is leading cause of female infertility and requiring ART. So our challenge in this research is PCOS patient can produce large number of oocytes. The specific effect on embryo quality and ART outcome remain the focus of this research. Because all of us, we know in PCOS, we have a large number of oocytes. But does these all oocytes become live embryo and lead to clinical pregnancy and the woman get a kids? This is the problem. So, the aim of our research to analyze key embryological parameters in the form of oocyte yield, fertilization rate, cleavage rate, and embryo morphology to assess the impact of PCOS on embryo quality and ART outcome. So our aim in this research to assess the type of embryo and the embryo quality and the percentage and the rate of this embryo to get real pregnancy and to get positive pregnancy outcome in ART. So the hypothesis of this research hypothesized that PCOS alter oocyte yield but compromise embryo quality. So PCOS may increase oocyte, as I say, but it is compromise the embryo quality. So our study design, it is a clinical case control prospective cohort study. We have 50 patients, 25 control and 25 the abnormal PCOS patient. Study group, women diagnosed with PCOS. Control group, the woman without PCOS. So this is the hypothesis of our study and the design of study. So we have a result. The first result of my study, the oocyte yield is increased significantly. The key finding in this study, PCOS patient achieve significantly higher oocyte count than control. So there is 60.96 plus 1, while control 9.3. So it is very significant p-value. This allies that PCOS pathology due to the accumulation of a small antral follicle. So there is significantly increase in the number of oocytes in the PCOS patient than the control patient. The second result, the fertilization rate. Our key finding in PCOS patient had significantly higher fertilization rate compared to the non-PCOS patient. There is 9.52 in the PCOS, while in control 6.6. So there is significantly increase in fertilization rate. So now we have an increase in oocyte, an increase in fertilization rate. It is very good news till now. So again, now come to the most important point in this study, the embryo quality. How it is compromised. This key finding, quality of embryo was poorer in PCOS group, particularly in lower grade. Now we see intermediate quality, grade 2B embryo, significantly higher in PCOS, 1.9, 1.3 in control. The p-value is very significant, 0.0. The lower quality embryo it is the more worst, the 3C, grade 3C embryo, also significantly higher in PCOS patient, 1.4 compared to the 0.1 in the control group. Sorry. This indicates that the quality of the embryo in the PCOS patient, grade 2B and grade 3C, significantly increase in the PCOS patient. That means instead of, although there is a lot of oocyte and a lot of higher fertilization rate of this oocyte, but the quality of the embryo, it is very low, and that leads to the decrease the pregnancy rate in the PCOS patient. So we have the result for about the hormonal profile in PCOS patient. AMH elevated markedly in the PCOS patient, significantly. In the PCOS group, it is 2.98, and in the control group, it is 0.1. So the AMH, it is very important indicator hormones in the PCOS patient, significantly increased. LH-FSH profile, in my research, I found it is not so significantly difference between the PCOS group and the control group. So AMH, it is most important than FSH-LH ratio. So this is the result that I found it in my research. And in my conclusion, the core takeaway, women with PCOS undergo ART, can produce large quantity of oocyte and achieve high fertilization rate. So the doctor, when he or she did an ART cycle for the woman with PCOS, he's very happy when he gets 15 oocyte of a pickup. And when the embryologist fertilized this oocyte, he's very happy that all this oocyte will be fertilized. So he thinks that he will get a lot of baby. But the reality is not, because not all these fertilized oocyte can grow and multiply to produce a healthy embryo. The quality issue, however, the quality of this oocyte is compromised, leading to significantly higher percent lower quality grade 2B and grade 3C embryo. So this is the cause that why the quality of the embryo, it is very low, because of the quality of oocyte. As the professor mentioned, the quality of oocyte in PCOS patient, it is very low because of meiosis, mitosis, inflammation, a lot of mechanisms that lead to low quality. So when there is low quality oocyte, definitely we have low quality embryo. So the implication, compromised embryo quality, potentially linked to the high, so now we talked about the cause of the poor quality embryo. Because of hyperandrogenism and inflammation is a key factor contribute to the poor reproductive outcome, such as higher risk of miscarriage despite high oocyte yield. So whatever the cause that the PCOS patient in natural pregnancy or in ART pregnancy, she had bad outcome, either miscarriage or even poor quality embryo in ART, and she will can't get kid with her to home. So the clinical implication and the future direction. So how we can solve these problems? Clinical need, individualized ART protocol are crucial, with a focus on preventing of ovarian hyperstimulation syndrome due to high oocyte yield. The recommendation strategy, the antagonist protocol with the freeze-all strategy, it is safest to approach this population. So, by my experience in the IVF and in all these problems, I found that freeze-all strategy, it is the most way to save the pregnancy in the ART patient with PCOS. Because when freeze all the embryo and don't make a fresh cycle, we can control the inflammation, control the problem with this patient with PCOS before we return the embryo back to the uterus. So the pregnancy rate, so the freeze all, it is very good for PCOS patient, better than fresh cycle. The future research, further investigation to specific management strategies like inositol metformin combination to decrease inflammatory problem with PCOS patient, and PGT test, it is very important to select viable embryo and improve live birth control. PGT test, it is not only done for these patients, they have congenital anomaly baby or they have problem. Even in PCOS patient, we should do PG test for this embryo to assess the viability of this embryo before return back to the uterus. Thank you very much for your attention.